Good morning, students. We are studying biomechanics of shoulder complex, and today we will study about the kinetics and the kinematics of glenohumeral joint. This will be the last video on the shoulder complex. Now, to understand the motions, to understand the kinetics and kinematics of glenohumeral joint, we need to know the motions which are, that is the osteokinetic motions of glenohumeral joint. Now, if you can see, this is this is your shoulder complex. There are motion is flexion, extension, abduction, adduction, internal and external rotation motion is there. Now, this is the simple kind of a motion. Now, if we can see, this is flexion and extension. The flexion and extension is taking place in the sagittal plane, and in sagittal plane you already know that it is a coronal axis, that is it is the x axis. This motion takes place in sagittal plane and in x axis, whereas the abduction adduction takes place in frontal plane and it lies in the z axis, and the medial and lateral rotation takes place in transverse plane and in y axis or the vertical axis. Fine. Now let us see the kinetics and the kinematics. Now you know guys that this is a flexion movement. The pure flexion movement, which is shoulder, the range of the shoulder joint flexion movement is only 120 degree. But we are able to do 180 degree. We will discuss about it later. But let us first understand the osteo and the arthrokinematics. Now you understand this is a concave bone and this is a convex surface. Now what will happen over here? The osteokinematics, that is opposite to the arthrokinematics. That is the concave stable bone and the convex movable bone. So that means if a convexo-concave rule will follow, the arthrokinematics will be opposite to that of the osteokinematics. Now let us see and define the movement. Now the first movement is called as flexion. The flexion is the upward and the forward movement of the head of the humerus. The upward and the forward movement of the head of the humerus. Now try to see how the head is moving. It is upward moving. Now this is the movement, upward and forward movement of the head of the humerus. Now what is happening at the inside the joint? Intra-articular motion. Now if this head is moving forward, what will happen inside is, it is rolling basically backwards. It is basically rolling backwards and gliding downwards inferiorly. It is rolling backwards, gliding downwards and spinning into internal rotation and spinning into internal rotation. The three motions which are happening at the shoulder complex is, one, when the flexion takes place, that is when there is upward and forward movement of the shoulder complex. There are three motion which is happening at the inside the joint, which is called as arthrokinematics. With the forward flexion, there is posterior rolling, inferior gliding and spinning in internal rotation. The flexion occurs with internal rotation. So this is the motion which is happening at in the flexion. So opposite will happen in extension. Extension, the movement is when the head or when the movement is when the shoulder is moving backwards, and it is backward movement of the shoulder is there. That is backward movement taking place. So head will move anteriorly and superiorly. The head is moving or rolling, and it is rolling anteriorly and it is gliding superiorly, and there is lateral rotation. There is a little bit of lateral rotation during the extension. So you have to understand that these three motion. With extension there is rolling, the head is rolling anteriorly, the head is moving superiorly or gliding superiorly. So because why this all is happening is because this surface, articular surface, is very small. The head is so large. In order to prevent this translation, or that is the head moving out of this articular surface, this gliding and sliding is very important over here. So you can see in extension the head is again rolling anteriorly and gliding superiorly and spinning in external rotation, so that the joint is congruent. So the range over here is, you can see, in flexion 90 to 120 degrees, the pure shoulder humeral range. Extension is 0 to 60 degree, and these are the muscles. You can see the muscles which are responsible for shoulder flexion: anterior deltoid, pectoralis major, clavicular part, and this is assisted by biceps and coracobrachialis. Whereas extension is done by posterior deltoid, latissimus dorsi, pectoralis major, sternal fibers, and teres major during maximum contraction. Fine. Now what happens in abduction? Let us see what happens in abduction. The abduction is, if first we need to define this. When we define this, it is the elevation movement in frontal plane. Now again, the arm is moving in elevation in frontal plane. Now this was the upward movement and forward movement, or this was the backward and downward movement, but here you can say the elevation movement of the arm in frontal plane. Now when this movement is taking place, you can see the head is, with this abduction movement, the head is first rolling upwards and gliding downwards. That is, when this movement is taking place, it is rolling upwards and gliding downwards, so that the contact between the head and the glenoid fossa is always there. So there is a movement which is happening. Is what is that? It is rolling upwards, but it is gliding downwards. This motion is brought about by deltoid and supraspinatus. The range is again same as 120 degree. Fine. And the adduction movement, as you can see, it is the depression of the arm in the frontal plane. Here the head is rolling downwards and gliding upwards. This is the movement. It is rolling downwards but gliding upwards. The movement is brought about by latissimus dorsi, teres major, pectoralis major, sternal part. Fine. Now let us come to the lateral rotation. Now if this is, you remember, this is the lesser tubercle, this is the greater tubercle. Fine. And this is the intertubercle sulci. Now if this is there, you can see over here that this movement medial rotation. As soon as we go in for this medial rotation, the lateral tubercle is responsible for a restriction. The movement is restricted because of the lateral tubercle bands over this area, the articular process. So in the medial rotation, the lateral rotation is free. The lateral rotation is more. Therefore, the range of lateral rotation is always more. It is a range of 90 degrees, 0 to 90 degree. Herein the head moves away from the midline. Can you see? If this is considered as the midline, the head is moving away from the midline, is said to be the lateral rotation. Now this range is 0 to 90 degree. Now when this movement is taking place, the head is gliding forward, but it is rolling posteriorly. It is gliding forward but rolling posteriorly, and this motion is brought about by infraspinatus, teres major, and posterior deltoid. Now opposite takes place in medial rotation, when the lesser tubercle will come and bang over here. You can see that the range is very less as compared to the lateral rotation. It is 0 to 70 degree. Here the head is moving towards the midline, and there is an interior roll but posterior glide. There is a rolling anteriorly, but there is a glide posteriorly. This is how you are going to define the motion and the osteo and the arthrokinematics of the glenohumeral joint. Now the very important topic which I want to discuss today is the integrated role of glenohumeral, scapulothoracic, acromioclavicle, and sternoclavicle joint. This is the integrated. We have in the last video we have also seen the integrated function of scapulothoracic, AC joint and SC joint, but we are now incorporating the glenohumeral joint because this is an integrated function of the shoulder complex. Now to understand this, we will just divide this into there is 2:1 ratio of glenohumeral joint motion and ST joint movement in arm elevation. When we elevate the arm, as I told you, the pure motion of shoulder flexion is only 120 degree, which is done at the glenohumeral joint. The last 60 degree is brought about by the scapulothoracic joint. We will be discussing about it. That is the abduction movement as well as the flexion movement which takes place in the shoulder. The 120 degree range is brought about by the glenohumeral joint, whereas whereas the 60 degree range is brought about by the scapulothoracic joint. So this ratio is 2:1 ratio of glenohumeral joint and ST joint movement during flexion and abduction, elevation movement. So this is very much important. To understand this, it is divided into basically three phases of elevation of movement. That is, the first is movement. Initial phase is the pure motion of glenohumeral joint, where ST joint doesn't play any role. Whereas in phase 2 and 3, both the joint contributes equally in both the joints contribute in bringing about completion of movement. So you can say that it is divided into three phases: initial phase, phase 2 and phase 3. Now this all movement is called as scapulohumeral rhythm. The coordinated movements of scapula and humerus during shoulder motion is called as scapulohumeral rhythm at a ratio of 2:1 is called as scapulohumeral rhythm. So herein we will be studying about the role of ST, GT and the glenohumeral joint, as well as the AC and the SC joint. So these four joints have a very good play in making or in the shoulder elevation movement, that is in flexion and abduction movement. Now in the phase 1, this is called as scapula setting phase. Now in this, it is a pure motion of glenohumeral joint. You can see over here in the diagram, the scapula is basically like this. There is no motion of scapula, whereas the head is moving from 0 degree to 30 degree of abduction. From 0 degree to 30 degree of abduction, this is the phase 1. Here the scapula is not moving. The scapula is again in a setting stage. So it is said to be scapula setting stage. Whereas the 30 degree of motion is taking place, and in this 30 degree there is no role of scapula. The scapula is in the setting stage, and you see is the clavicle is elevating. During this phase there is a elevation at SC and AC joint. That is, elevation movement is taking place, which is round about at 5 to 10 degree. 5 to 10 degree. Fine. Setting phase of scapula. With the first 30 degree of abduction, the scapula shows minimum movement, while the clavicle elevates between 5 to 10 at SC and AC joint. Now the second phase is from this 30 degree up to another 60 degree. You can say up till another. It can be in different books, says different contexts. There some say it is 40 degree, some say it is 60 degree. But taking into account, if we take 40 degree or 60 degree, I'll say from 30 degree onwards till another 60 degree. That is when the shoulder is at 90 degree actually. Fine. The another this degree, there is equal movement of. There is some movement at humerus, that is there is round about 60 degree movement of humerus, but the scapula has also started rotating. Now this is the scapula when this was 30 degree. Now as soon as it goes up till 90 degree, the scapula has started moving. Can you see over here? From 30 degree and we have come to 60 degree, the scapula has moved. From this position it has moved up. This angle of rotation of scapula is round about the 20 to 30 degree. 20 to 30 degree, and the clavicle, basically the elevation, along with this elevation, when this movement is taking place, there is basically at the level of the clavicle there is posterior rotation has started, because this is not possible. The clavicle is lying somewhere here, and it is not possible that there is no motion which is happening as AC and SC joint. You also know that with the upward movement there is some kind of a rotatory movement as well as elevation movement. The rotatory movement was around about 2/3 of the SC and AC joint, whereas the elevation movement was only 1/3. So the degree of movement of elevation is, if I say, is 5 to 10 degree. The rotational movement is more, that is, it is around about 25 to 30 degree. Posterior rotation is taking place. Now if you can see, after the 30 degree of abduction, the humerus and the scapula start moving in the ratio of 2:1. When this humerus was moving from 30 degree to 90, that is 60 degree of range was there, the scapula was also moving from 0 degree to 30 degree. There was a rotational movement which was happening at the scapula. Therefore, this kind of a ratio which is seen is the humerus to scapula ratio is 2:1 ratio. Now you can take another example. If the humerus is moving only 40 degree, from 30 degree to 40, that is somewhere 70 degree, the scapula will move only 20 degree. If the humerus abducts 40 degree, the scapula will laterally rotate 20 degree, and the clavicle will elevate 15 degree and it will also begin to rotating posteriorly. It will begin posterior rotation. Fine. Now the third phase is, that is from this 90 degree, we will go up to which degree? 180. So another last 60 degree, or if it is in this position, it will go for another 60 degree of abduction. We can take another 60 degree of abduction. When this degree is taking place, can you see it is banging at the tubercle. So what is happening is there is a kind of a lateral rotation which is happening. At 90 degree, the arm goes into lateral rotation so that the greater tubercle don't bang at the coracoacromial arch. So there is no impingement. So at 90 degree, first the arm goes into lateral rotation of 90 degree and then it moves into 180 degree of motion. Fine. The scapula in this, the scapula was 30 degree. It has moved like this. The scapula has further moved to 30 degree. So the total motion over here was, initially it started from 30 degree and another 30 degree motion, that is total of 60 degree motion has taken place. Whereas the humerus was at 90 degree and it has gone again into another 90 degree, that means 180 degree motion has taken place. And what happened at the clavicle? The clavicle has gone into 60 degree of posterior rotation, 50 to 55 degree of posterior rotation. So this is the final thing which has happened. The humerus abducts another 60 degree, lateral rotation of 90 degree to avoid impingement between the greater tuberosity of the humerus and the acromion process, and the scapula laterally rotates to another 40 degree and clavicle rotates 30 to 50 degree posteriorly and elevation still continues at 15 degree. So the total amount of 60 degree of lateral rotation of the scapula during second phase and third phase is made possible only by 20 degree motion at the AC joint and 40 degree motion at the SC joint, at the SC, sternoclavicle and the acromioclavicle. Acromioclavicle contribute towards 20% of the movement, whereas 40% of the movement is done by the SC joint. Fine. So you can see the range, the 30 degree, how this 30 degree to another 60 degree added, it has become 90 degree, and to another that 90 degree, the 60 degree is added. So you can see it is already 160, but ideally it is 180. So you can see this 30 degree further go on into rotation of 60 degree at scapula. Now scapulohumeral rhythm serves two purposes. One, it preserves the length tension relationship of glenohumeral muscles. That is, the muscles do not shorten as much as they would without scapular upper rotation. The rotation of this scapula, it gives a very good length tension relationship of all the muscles around this shoulder complex, and they are able to produce maximum force and maximum range of motion because of this scapular rotation. Fine. The second is, it also prevents the impingement by, if there is lateral rotation which is happening, so it is preventing the impingement of the humerus at the acromion. So there are two purposes, main purpose, length tension relationship, it preserves the length tension relationship and it prevents the impingement between the humerus and the acromion. So this I have tried to show you the AC and the SC joint function, as I just wanted to revise you guys that when the scapulothoracic movement is taking, upward rotation is taking place, AC joint is also moving in upward direction, whereas SC joint has got two functions. The primary function is anterior and posterior rotation, which is 2/3 of the motion, and the secondary is elevation and depression, which is 1/3 of the motion. So here the posterior rotation is 30 to 50 degree and elevation is 15 degree, which has happened. So this is the motion which is happening at AC and SC joint. 20% of the motion at AC joint and 40% of the motion is done at SC joint. So this is why how the 60% is being formed at the scapulothoracic joint. Now what about these muscles? Now how this, if this range of motion is happening, so there are some muscles also which are working. Now to understand the muscles, this diagram is very good. Now if you can see, the elevation part is done by rhomboids, trapezius, levator scapulae. The depression or the gliding, inferior gliding part is done by trapezius and pectoralis minor. The forces, you can see the medial directed forces, The muscles which are working are rhomboids, trapeze, levator scapulae, and if you can see the lateral directed forces are done by the serratus anterior and pectoralis minor. There is another forces which are there. These are two arrows, which is for the upward rotation. The upward rotation is brought about by trapeze and serratus anterior, whereas downward rotation is brought about by pectoralis minor, levator scapulae and rhomboids. Fine. So you can see this is the 60 degree of motion at the scapula, whereas 120 degree of motion is taking place at the glenohumeral joint. So the total of 180 degree of motion is of shoulder elevation is possible because of the two major contribution, that is of glenohumeral and scapulothoracic. Now muscle activity, I have tried to make it in table. Phase 1, 0 to 30 degree of abduction. The glenohumeral motion is 30 degree of abduction. Scapulothoracic, no motion is taking place. Clavicle 10 to 50 degree of elevation. The muscle responsible is supraspinatus and deltoid. Phase 2, that is from 30 degree to 90 degree of motion, where the ratio is 2:1. The glenohumeral motion is 60 degree of abduction. Scapulothoracic is 30 degree of posterior rotation, and is upward rotation, and clavicle is 30 degree of posterior rotation. Upper and lower fibers of trapeze and serratus anterior are responsible for this. Phase 3, again final 90 degree of abduction. The glenohumeral has gone into again 60 degree of abduction and 90 degree of lateral rotation. Scapulothoracic 30 degree of rotation. Clavicle 30 to 50 degree of posterior rotation. Again the lower and the upper fibers of trapeze and serratus anterior are responsible for this motion. Now, clinical significance. There is a word called scapular dyskinesis. That means dyskinesis word we use when we see winging of scapula. This is called as winging of scapula. Now, what happens over here? This is possible because if these muscles are not working at a point, there will be a winging of scapula. So, which muscles are there? If the posterior capsule of glenohumeral joint is tight, or if the levator scapulae, pectoralis minor, latissimus dorsi, these three muscles, they are shortened, what will happen is there will be alteration in the scapulohumeral rhythm, and the medial border of the scapula will be prominent. Herein the medial border of the scapula will be prominent when the elevation activities or when the arm is abducted and flexion is taking place. Or there is second is this is one of the major reasons of the dyskinesis of winging of scapula. So what as a physiotherapist we need to do is we have to teach them stretching of these short muscles. Which short muscles? Posterior joint capsule or the posterior capsule of shoulder joint. That is, we give them stretches of levator scapulae, pectoralis minor and the latissimus dorsi. We also teach them shoulder stabilization exercises, or basically the scapular stabilization exercises. All the rotator cuff muscles, infraspinatus, supraspinatus, subscapularis, teres minor. These are the muscles which are the stabilization exercises should be given to them. Fine. I think with this the scapulohumeral rhythm and the motions of the shoulder joint are complete. Now, if we see this is a shoulder complex, and in this shoulder complex we have seen that it is not a stable congruent joint. It is an incongruent joint. So it has got strong capsule but it is weak. It has got a labrum. It has got ligaments to basically make it congruent, but it has also got muscles around it. Now these muscles make it further congruent. So the next thing is how these muscles stabilize the glenohumeral joint. We will study about it. The first is called as the static stabilizers of shoulder complex. Now when the shoulder complex is like this, that is when the arm is at rest, at that moment the muscles are not acting. But then also the head is not moving down. Why the head is not moving down? Because there is a force called force of gravity which is pulling the arm downwards, and you see the head is not moving down over here. Why? Because there is some static stabilizers at the shoulder complex which is holding the head at its position. Now we have to discuss about the static stabilizers of shoulder. The first is the rotator internal capsule, which we have discussed in the previous video. Now you see the rotator interval capsule was a gap or an interval between the supraspinatus and the, it was like this, a triangular space between the supraspinatus and the subscapularis. There was an interval, there was a gap, and there were some structures which was passing through it. We saw that, and these structures were, let me show you in this form, like this. Now if it is, what was the structure? It was the superior capsule, the coracohumeral ligament, and the superior glenohumeral ligament. These were three ligaments, and they were passing through it. Now what is the role of rotator interval capsule is, now during the static, or during when the arm is at rest and when the muscles are not contracting at that point, this becomes taut. The structures which are passing through the rotator interval capsule becomes taut, and they hold, since they are crossing. If this is the head, if this is the structure, you can see the V, it is basically holding the head. It is basically holding the head tightly, and it is preventing the inferior translatory movement or inferior dislocation of shoulder. So by the effect of gravity, if the gravity is pulling the head of the shoulder down, whereas the head of the humerus down, whereas the rotator interval cuff muscles are taut at this moment, or the rotator interval capsule structures are taut at this moment and holding the head. The second structure is the joint capsule. The joint capsule act as a suction, because you understand the joint capsule is weak. It is 2.5 size of the shoulder complex or the shoulder head. The joint, humeral joint is 2.5 size larger than this, and it is weak and it is loosened at the inferior part. So it is also very important, because it is attached to the head of the glenohumeral head as tightly, and as in the form of suction form. Have you seen this suction band, magnets, or suction cups which we use in therapy also? So this capsule is basically attached to the head as a suction cup, and it prevents the movement of the head. So it is how this negative intra-articular pressure created by the joint capsule also is responsible for maintaining the congruency of this joint when the arm is lying at the rest or is lying beside the trunk. Then there is inclination of glenoid fossa. Now you can see the glenoid fossa is little bit anteriorly oriented. Now if this is a glenoid fossa, can you see this? If this is glenoid fossa, it is little bit anteriorly oriented. Now this interior orientation of this glenoid fossa prevents any kind of translatory movement to happen in the, if this angle is varies with person to person. So this is one of the factors which was studied. So I have written over here as inclination of the glenoid fossa also plays a very crucial role. And the next is when the arm is lying in resting position and you carry some weight, supraspinatus muscle contracts, and it brings about this contraction brings about holding the head tightly to the glenoid fossa. So in this position it holds the head to the glenoid fossa. So that means during the no motion, or when the muscle contraction is not taking place, or when the shoulder joint is in rest, rotator interval capsule, the negative intra-articular pressure of the capsule, the inclination of the glenoid fossa are responsible for holding the head or making the joint congruent. And if in this position you are holding some weight, then supraspinatus come into play. Now what are all stabilizers when motion takes place? Now they are called as dynamic stabilizers of shoulder. Now these dynamic stabilizers of shoulder they basically make the joint congruent when these muscles play a very crucial role when the joint is taking or joint is moving. The first role is of deltoid and rotator cuff muscles. Now if you can see this diagram, this is the insertion of deltoid which is taking place. You understand deltoid is basically a 3-fiber muscle that has got anterior, middle and posterior fiber. The action line is basically around the middle. The action line or the resultant is at the is towards the middle deltoid. Now if we take as the insertion of at the deltoid tuberosity, we see, and this is the force vector, and we divide or resolve this force vector into two components. One is translatory component, one is rotatory component. Now this is the translatory component and this is the rotatory. Can you see the rotatory component is very much small, whereas the translatory component is very large. The magnitude of translatory component is large and the magnitude of the rotatory component is very less. So this is responsible for lateral movement of the or lateral rotation of the humerus. Fine. Whereas this is responsible for superior translation of the head of the humerus. So now this magnitude is more. So the deltoid is responsible for the superior translation motion, and but which is not right. If this, it is not allowed to move, it will not allow any elevation activity, because then there will be superior translation which will take place. Now this, to counteract the action of deltoid, rotator cuff muscles come into play. Can you see infra, subscapularis and teres minor muscles? Their action lines are shown over here. Now if you see, the another action line is downwards, which offsets the translatory function. That is, this is the rotatory, this is the resultant component, and if I divide it into two parts, this will be the rotatory component and this will be the translatory component. The translatory component offsets the translatory component of the deltoid. So that means the superior translatory motion is offsetted by the translatory motion at the rotator cuff muscles. So they are basically cancelled. So what is happening is the lateral rotation is now possible, and this lateral rotation will cause a joint compressive forces and will increase the congruency of the head on the glenoid fossa, increase the congruency of the shoulder joint, increase the congruency. If I can repeat this again. Now you have seen the deltoid component is divided into two parts, the translatory component and the rotatory component, and the rotator cuff muscles, they are also divided. This is the resultant part. It is divided into two components. One is the rotatory component and another is the translatory component. The translatory component of both offset each other, that is cancel each other. Now the two rotatory components are working. Now this rotatory components will bring about the lateral rotation of or the elevation of the shoulder, abduction and flexion of the shoulder, and this component will bring about the increase in the joint congruence, that is it will bring about the joint compression. Now more will be the joint compression and more will be the stability of the joint when the elevation or upward movement activity or flexion movement activity is taking place. Fine. Did you understand the role of deltoid and rotator cuff muscles during the motion, during the arm motion? The second work is again of supraspinatus muscle. Now again, supraspinatus muscle is basically what is it is basically attaching here. Now what is happening, it has also been divided into two components. Can you see for yourself? One is again, one component is the translatory component and another is the rotatory component. If the supraspinatus muscle is divided into two, the action line is converted into two. The superior translatory component is very much less. The magnitude of this motion is less, but the joint compressive forces are more. That means whenever the initial 30-degree motion takes place, this is responsible for, the rotatory component is responsible for joint compressive forces and increases the joint congruency, increases the joint stability during the initial 30-degree of motion. Fine. So this is the role of supraspinatus during initial 30-degree or initial motion of the shoulder complex. Long head of biceps also play a very crucial role. Now if you can see in this diagram, I want to show you in this diagram. Now you see this is the supraspinatus muscle, this is the subscapularis muscle. Now this I want to show you in this form also. Now this was the V which I was showing you. This is the again that capsule. This is the supraspinatus and this is the subscapularis. Now this is the, if you can see, this is the intertubercle groove and through which the long head of or the tendon of biceps is passing. That is, the long head of biceps is passing from here. Now this come into play whenever shoulder movement or shoulder flexion takes place, because this contracts. Now as soon as this long tendon it becomes contracts, it causes a compressional forces at the joint, and it doesn't allow any movement to happen, that is superior, inferior and the anterior or posterior motion at the humeral head. Why so? Because if you see this, it is passing like this over here. Now, and whenever the movement takes place, it starts to contract. Now, as soon as you contract, the head cannot move anywhere. That is, the head movement that is the translatory movement. It is checked by the long head of the biceps. Now, this is the long head of the biceps, which is passing from the supraspinatus and in between the subscapularis, where there is an insertion of or where it is passing, there is an intertubercle is there, groove is there, and here is the long head of the biceps. It contracts and it holds the head during the dynamic movement. So they play a very crucial role during dynamic movement. Deltoid, rotator cuff muscles, long head of biceps and the supraspinatus play a very crucial role in stabilizing and bringing about the joint stability when shoulder movement takes place. Guys, I hope you have understood the shoulder complex. With this, I will wind up the shoulder complex, and if you have any queries and if you have any doubts, you can put it in comments, and we will be starting elbow joint soon. Thank you.